Do you suffer from skin conditions like psoriasis or eczema? Are you tired of trying countless treatments that don't seem to work? Look no further. Clobetasol may be the solution you've been searching for. As a highly potent corticosteroid, clobetasol has proven to be incredibly effective in treating a variety of skin conditions. But with such a powerful medication, it's important to know how to use it safely and effectively. That's why we've created the ultimate guide to clobetasol, a comprehensive resource that covers everything from what it is, how it works, and how to use it properly. Whether you're a first-time user or have been using clobetasol for years, this guide will provide you with the knowledge and tools you need to effectively treat your skin condition and achieve lasting relief. So, let's dive in and discover the power of clobetasol. Understanding skin conditions treated by clobetasol. Clobetasol is a topical steroid medication that is used to treat a variety of skin conditions. Some of the conditions it is commonly used for include psoriasis, eczema, dermatitis, and lichen planus. These conditions are characterized by inflammation and irritation of the skin, which can cause redness, itching, and scaling. Clobetasol works by reducing inflammation and suppressing the immune response that causes these symptoms. Psoriasis is a chronic autoimmune condition that causes the rapid buildup of skin cells. This leads to thick, scaly patches on the skin that can be itchy, painful, and embarrassing. Psoriasis can occur anywhere on the body, but it most commonly affects the scalp, elbows, knees, and lower back. Eczema, also known as atopic dermatitis, is a common skin condition that affects people of all ages. It causes dry, itchy, and inflamed skin, and can be triggered by a variety of factors, including stress, allergens, and irritants. Eczema can occur anywhere on the body, but it most commonly affects the face, hands, and feet. Dermatitis is a general term that refers to inflammation of the skin. There are many different types of dermatitis, including contact dermatitis, seborrheic dermatitis, and nummular dermatitis. Each type of dermatitis has its own set of symptoms and triggers, but they all share the common characteristic of skin inflammation. Lichen planus is a chronic inflammatory condition that affects the skin, mouth, and genitals. It causes small, flat-topped, itchy bumps on the skin, and can be triggered by a variety of factors, including stress, infections, and certain medications. Lichen planus can occur anywhere on the body, but it most commonly affects the wrists, ankles, and lower back. How does clobetasol work? Clobetasol is a highly potent corticosteroid that works by reducing inflammation and suppressing the immune response that causes skin conditions. It is available in both cream and ointment form, and is typically applied directly to the affected area of skin. Once absorbed into the skin, clobetasol works to reduce inflammation and relieve symptoms such as itching, redness, and scaling. Clobetasol works by binding to specific receptors in the skin cells, which in turn activates a series of chemical reactions that reduce inflammation. It also inhibits the production of cytokines, which are proteins that play a key role in the immune response that causes skin conditions. By reducing inflammation and inhibiting cytokine production, clobetasol effectively suppresses the immune response that causes skin conditions. Clobetasol cream versus ointment, which is better? Clobetasol is available in both cream and ointment form, and the choice between the two depends on the severity of the skin condition and the area of the body being treated. Creams are generally better suited for mild to moderate skin conditions, as they are lightweight and easy to apply. They are also less greasy than ointments, which makes them a good choice for use on the face or other areas where the skin is more delicate. Ointments, on the other hand, are thicker and more greasy than creams, which makes them better suited for severe skin conditions or areas of the body that are thicker or more prone to dryness. They are also more effective at locking in moisture, which can help to soothe and heal dry, cracked skin. Ultimately, the choice between clobetasol cream and ointment depends on the individual skin condition and personal preference. It may be necessary to try both forms of the medication to determine which one works best. Clobetasol dosage and application instructions. The dosage and application instructions for clobetasol depend on the severity of the skin condition being treated, as well as the age and overall health of the patient. In general, clobetasol should be used sparingly and only as directed by a healthcare professional. For adults, a typical dose of clobetasol cream or ointment is a thin layer applied to the affected area of skin once or twice a day. The medication should be rubbed in gently until it is absorbed by the skin. It is important to avoid using clobetasol on large areas of skin or for prolonged periods of time, as this can increase the risk of side effects. For children, the dosage and application instructions may differ depending on the age and weight of the child. It is important to consult with a healthcare professional before using clobetasol on a child. Precautions and side effects of clobetasol. Like all medications, clobetasol can cause side effects, especially if used improperly or for prolonged periods of time. Some of the most common side effects of clobetasol include 1. Burning, itching, or stinging at the site of application. 2. Dryness, redness, or peeling of the skin. 3. Thinning of the skin or stretch marks. 4. Acne or other skin eruptions. 5. Changes in skin color or texture. It is important to use clobetasol only as directed by a healthcare professional and to avoid using it on large areas of skin or for prolonged periods of time. If you experience any of these side effects, it is important to contact your healthcare provider right away. In addition to these side effects, clobetasol can also have more serious side effects in rare cases. These can include 1. Increased risk of infection. 2. Cushing syndrome, a condition caused by prolonged exposure to corticosteroids. 3. High blood sugar levels. 4. Eye problems, if the medication comes into contact with the eyes. It is important to discuss the potential risks and benefits of clobetasol with a healthcare professional before using it. Alternatives to clobetasol. While clobetasol can be an effective treatment for many skin conditions, it is not the only option available. There are a variety of alternative treatments that may be effective for certain skin conditions, including 1. Topical calcineurin inhibitors, which are used to treat eczema and other inflammatory skin conditions. 2. Topical retinoids, which are used to treat acne and other skin conditions. 3. Phototherapy, which involves exposing the skin to ultraviolet light to reduce inflammation and promote healing. 4. Immunomodulators, which work by suppressing the immune response that causes skin conditions. It is important to discuss the potential benefits and risks of these alternative treatments with a healthcare professional before using them. Clobetasol and pregnancy, breastfeeding. Clobetasol should be used with caution during pregnancy and breastfeeding, as it can be absorbed into the bloodstream and potentially harm the developing fetus or nursing baby. It is important to discuss the potential risks and benefits of using clobetasol during pregnancy or breastfeeding with a healthcare professional. In general, clobetasol should only be used during pregnancy or breastfeeding if the potential benefits outweigh the potential risks. Frequently asked questions about clobetasol. 1. How long does it take for clobetasol to work? 2. Clobetasol typically begins to work within a few days to a week of starting treatment. 3. Can clobetasol be used on the face? 4. Yes, clobetasol can be used on the face, but it should be used sparingly and only as directed by a healthcare professional. 5. Can clobetasol be used on open wounds? 6. No, clobetasol should not be used on open wounds or broken skin. 7. Can clobetasol be used on children? 8. Yes, clobetasol can be used on children, but the dosage and application instructions may differ depending on the age and weight of the child. 9. How long can clobetasol be used for? 10. Clobetasol should only be used for as long as directed by a healthcare professional. 10. Prolonged use can increase the risk of side effects. Conclusion and final thoughts. In conclusion, clobetasol is a powerful corticosteroid that can provide significant relief for various skin conditions. However, it is crucial to approach its use with caution and under the guidance of a healthcare professional. By following the prescribed instructions, understanding the mechanisms of clobetasol, and being aware of its potential risks and benefits, you can effectively manage your skin condition and experience long-lasting relief. When using clobetasol, it's essential to remember that it should be applied only to the affected areas of the skin and in the prescribed amount. Avoid using it on sensitive areas, such as the face or groin, unless specifically instructed by your healthcare provider. Overuse or prolonged use of clobetasol can lead to adverse effects, including thinning of the skin and increased susceptibility to infections. While clobetasol can provide remarkable results, it is not a long-term solution. It is designed for short-term use to control flare-ups and manage symptoms. If you find that your condition persists or worsens despite using clobetasol as directed, it is important to consult your healthcare provider for further evaluation and alternative treatment options. Furthermore, open communication with your healthcare provider is crucial. If you have any questions, concerns, or experience any unexpected side effects while using clobetasol, don't hesitate to reach out for guidance. Your healthcare provider is there to ensure your safety and well-being, and they can provide valuable insights and recommendations tailored to your specific needs. In conclusion, Clobetasol can be a valuable tool in managing skin conditions and finding relief from symptoms. However, responsible and informed use is key to its effectiveness and safety. By working closely with your healthcare provider, following their instructions, and being proactive in your skincare routine, you can achieve optimal results and improve your overall skin health. Remember, your skin deserves the best care, and with the right approach, you can effectively manage your condition and enjoy healthier, happier skin. Thanks for watching.